In this video, we're going to show you how to complete a Loccsip form for flexible cystoscopy procedures in theatres. In order to do this, we would have the PowerChart application open, and we would need to go into the search window to the right to search for our patient. So we can use the drop down to filter to an MRN, the patient's name, or the FIN. So we're going to search via the MRN. And in the search window, we're going to type the MRN for the patient in and hit search. Patient search will appear, asking us to select the correct patient. So we can see here we have our test patient, and we would click OK. We might need to add in the facility. We would scroll down to the appropriate facility. So now we have the patient's record open. We would need to navigate to the ad hoc folder, to the surgery folder, and to the Loccsip checklist. We would need to tick the empty box next to the checklist and then hit record. We can see within the Loccsip checklist that we have 4 different sections. The first section is order results. Within this section, we'll be able to see any results that have been ordered against the patient and that have been outcomed will be visible within this template. We can see here that the patient has no orders requested or resulted. Our next section is our checklist. Please note that we are in the cert domain at the moment, so where it says preoperative checklist, this will not be the case in the live domain. So here we have the first field would be the procedure. We would type in the procedure completed. Here we have our observations. Please note that this field would not be visible. We would have a smart template here, and it would show any observations that have been pulled through previously if the patient's been associated to a BMDI machine, etc. But we can manually add in any information here if we needed to. If we scroll down, we can see that the next section is around test results. Has a urinalysis been completed? Yes or no? We would select as appropriate. And we would document the date and time. If we click into here, we can say today. And for time, we could say N for now. The next section is around preparation of the patient, and we can see there are a few different mandatory fields. The difference between the 2 boxes is that the first box only has the option of yes or comment, and the second box has the option of yes, not applicable, or comment. So for the first question on the preparation of the patient, we need to verify the patient's name and details. So we're marking to say we've done that. We need to make sure the patient understands the procedure, and we're saying yes, we've done that. We need to make sure that the consent's confirmed. We need to make sure that the allergies have been reviewed. And we can review the allergies within the next tab, which we will navigate to in a moment. Has the patient been given local anaesthesia? We can say yes, or if not appropriate, we can say not applicable. Have we disposed of sharps? If we have, yes. If we haven't, we can mark it as not applicable. Have blood thinning agents been given? Yes or not applicable. And is the bladder empty? Yes or not applicable. We also obviously have the ability to add a comment in here on any of these fields just by clicking. And we also have an additional comments box below if we need to. So the next section in the Loccsip checklist is height, weight and allergy. Here we can review any allergies. We can add allergies in if the patient informs us of any allergies. But we can see here that there are no known allergies on this patient's record. We also have a height and weight section. Here we can put any height or weight recorded on the patient. And lastly, we have an infectious disease risk screening. And we would document if the patient had any recent travel and if all PPE requirements have been risk assessed. Once we've completed the form, we can see that where there was once a red asterisk, we now have ticks. This just tells us that all the mandatory fields within these two tabs have been fulfilled, and we can just sign to save the form. That form's now saved, and if we navigate to the documentation section of the patient's record, we will be able to see that at the top of there we have preoperative checklist Flexi. We click on that, we can now see that the Loccsip checklist appears on the right with all of the information visible, and that is visible to everyone within the patient's record. Anything else with flexible cystoscopy, such as the scope details, staff in attendance, any procedure documentation details or results, are all going to be documented by the surgeon in the outpatient end page. So no other documentation such as intraoperative records, anaesthesia records, none of that would be completed by the theatre staff.